Hello, my name is Corrine, and I am a nurse here at Shield Surgery Center in Medford. Thank you for watching this online class that will provide you with some information regarding your upcoming joint replacement surgery. This class contains some basic information and is a general guide. It may differ slightly from your surgeon's instructions, so if there are any discrepancies, the information from your surgeon should be followed. This is a picture of our surgical center located at 170 Governors Avenue in Medford, Massachusetts. It is located next to the Lawrence Memorial Hospital and the School of Nursing.
At Shield Surgery Center, all of the staff work together as a team. Each of us has a unique role in providing you with the care to ensure that you have a positive experience and the best outcome from your surgery. You will meet several of our team members, including our front desk staff, our nurses, your surgeon, the anesthesiologist, and physical therapist. You are also a member of the team, in fact, the most important member, and to ensure the best outcomes, you have a job to do as well. The first is to complete your preoperative appointments, get your labs drawn, and your EKG done prior to your surgery. You must also complete the pre-admission questionnaire from a link that will be sent to you from Sys Exchange about a month before your scheduled surgery. This is where you will enter your health history and medications. A nurse will call you one business day before your surgery with your arrival time and to reiterate the preoperative instructions. He or she will also let you know which medications you should take on the morning of your surgery. Because you will be going home on the same day as your surgery, it is very important to consider your home situation to prepare adequately. Do you have multiple stairs to enter your home? Do your stairs have a secure hand railing in place? Is your only bathroom upstairs? Do you have someone to spend the first night or two with you when you get home? It is vital to consider these concerns while planning. Many people will set up the main level of their home for sleeping for the first several nights, since managing the stairs can be difficult right after your surgery. It is always best to plan and to have a backup option in place just in case you have any difficulty once you get home. Any concerns about this should be discussed with your surgeon. Prior to your surgery, it is recommended that you perform a walkthrough of your home, especially in the areas that you will be recovering in. Be sure that the areas between your bed, bathroom, kitchen, and living room are free from any fall hazards such as clutter, extension cords, or loose or curling rugs. If you have your crutches or walker already, it is a good idea to walk through with those devices to make sure that you will have enough space and enough lighting to be safe. Keep in mind that you will not be as mobile as you usually are. Therefore, planning ahead for physical tasks is essential. Tasks may include activities such as caring for a pet, food shopping and meal preparation, gathering the mail, and taking out the trash. Reaching out for help from family and friends before the procedure or arranging for services such as food delivery or pet boarding may be necessary. Every person has different needs for equipment following surgery. Most people end up going home needing a walker and a set of crutches. The walker is the easiest and safest option for the first week or so post-op, but crutches must always be used with stairs. Since your insurance usually only covers the cost of one assistive device to walk with, many patients will opt to borrow equipment from friends, family, or even a local senior center. However, we do have walkers and crutches on site and can provide them to you on the day of surgery and bill your insurance. A raised toilet seat is often beneficial for those having a hip or knee replaced to ease getting on and off the toilet with less pain. If you plan to purchase or borrow one before your surgery, a 3-in-1 commode is recommended. This fits nicely over any toilet without any tools or attachments, is easily adjustable in height, and has armrests to help you get up and down. It can also be used as a freestanding commode if you end up having difficulty with mobility in the first few days at home. These can easily be purchased online for about $40. Additionally, a shower chair may also be beneficial for you to ensure safety when showering during the first couple of weeks at home. Some other adaptive equipment that people find helpful include devices such as a reacher to pick up objects from the floor, a long-handled sponge to wash your feet in the shower, a sock aid to assist with putting socks on if you are having trouble reaching your feet, and a long-handled shoehorn. These devices are optional. However, many people find them helpful during the first few weeks after surgery when you are less mobile. They also can be easily purchased online for a relatively small cost. Before your surgery, it is a good idea to maintain as much strength and mobility as possible. Your surgeon may have provided you a list of preoperative exercises, or you can use the exercise packet provided to you by Shield Surgery Center, which are attached to an email from our surgical scheduler. It's a good idea to start these exercises a few weeks before your surgery, but don't overdo it. You don't want to be sore on the day of your surgery. In addition to building strength and flexibility, you want to make sure that you have the building blocks to heal readily available in your system. That means eating a healthy diet in the weeks prior that include protein, vitamins, and minerals. If you are diabetic, be careful to monitor your blood sugar and try to keep it in a healthy range. Keeping your blood glucose under control helps to promote optimal healing and reduce your risk of getting an infection after your surgery. If you use any type of tobacco or nicotine products, it is recommended that you avoid using them in the weeks before and after your surgery. Nicotine in any form reduces blood flow to your surgical site and can delay healing. Using any type of inhaled substances can increase your risk for developing pneumonia. To reduce your risk of a postoperative infection, we recommend that all patients use a chlorhexidine or Hibiclens soap each day for the 5 days before your surgery. This is an antibacterial soap found at any pharmacy and is available over the counter. The way you should use this soap is to shower as normal. Then at the end of your shower, apply the lotion-type soap from the neck down. Do not use it on your face or in your hair. It is important to leave it on your skin for 3 to 5 minutes before rinsing it off. Do not scrub because it may cause irritation. It can also make your shower floor very slippery, so be sure to rinse the tub or shower well to help avoid slipping and falling. You should use this soap on the morning of your surgery. However, if you are scheduled to be here very early in the morning, you can do it the night before. Additionally, we recommend that you avoid shaving at or around the surgical site in the week or so prior to your surgery to reduce your risk of developing any small cuts that could allow bacteria to enter and cause an infection. The day before your surgery, give your surgeon a call if you do not feel well. It is usually not recommended to have an elective surgery if you are ill or have a fever. Additionally, if you develop any kind of rash or wound, the surgeon will want to know. When in doubt, call. The surgeon may have you come in to be evaluated the morning of your scheduled surgery before he or she decides how to proceed. Also, you are to have nothing to eat or drink after midnight or at least 8 hours before your scheduled surgery time, except for a small sip of water with any medications you were instructed to take. This is to help reduce your risk of developing complications from anesthesia. On the day of surgery, you should wear loose, comfortable clothing such as a loose, oversized t-shirt, loose, stretchy, comfortable pants, and appropriate footwear. You should avoid tight clothing such as jeans or anything with zippers and buttons that may be challenging to get on and over a bulky bandage on your hip and knee. You should also come in with no lotions on your body, no contact lenses in, or any jewelry on. If you do wear glasses, dentures, or hearing aids, you should wear those in. Leave cash and all of your other valuables at home. Most people do bring in their cell phone to touch base with their family members after surgery and also to give you something to do in the event that your surgery is a little delayed. Again, we are located at 170 Governor's Ave in Medford. You should get dropped off under the awning at the main entrance, and this is where you will be picked up as well. If you are going home in the same vehicle, you could push the passenger seat all the way back and recline it a little when you get out, then it will be ready for you upon discharge. Make sure you bring in your insurance card and photo ID. Once you are dropped off, go through the 2 sets of sliding doors and turn immediately right. We are at the first door on the right, across from the reception desk in the lobby. Your friend or family member may come in and stay in the lobby if they wish. However, they will not be allowed into the recovery area until after your surgery. Once you are checked in at the desk, a nurse will come out and bring you back to the preoperative area. There you can use the bathroom and get changed into a gown. The nurse will ask you many questions and start an IV line. You will be seen by both the anesthesiologist and the surgeon, who will mark your hip or knee. Do not mark your own body at home, as this can cause confusion in the operating room. Then you will sign your consent forms, and the nurse may also give you some medications as ordered by the doctors and apply compression boots to your legs. The mobile compression boots or sleeves, also called SCDs or sequential compression devices, are applied preoperatively and will remain on your legs until discharge. The nurse will show you how to apply them, turn them on and off, and how to charge them. These will go home with you, and you are to wear them for a few weeks whenever you are not walking. These will help to reduce your risk for developing blood clots. What you can expect during surgery is hopefully a nice nap. But seriously, the surgeon and anesthesiologist will decide on the type of anesthesia you will receive for your surgery. It is usually a combination of a numbing agent such as a spinal or nerve block and general anesthesia. Most are in the operating room for about 2 hours. If your family member or friend decides to stay on site, there is a small cafe in the lobby, free Wi-Fi, and a tracker board to monitor your progress. If you do happen to have any questions about your anesthesia or surgery, it is a good idea to ask when you are in the preoperative area before you get any type of sedation. After surgery, you will return to the recovery area, and a nurse will care for you until you go home. They will monitor your vital signs, administer pain medication as needed, and also call your ride. The physical therapist will also evaluate you before you leave. We encourage you to have a caregiver present for discharge instructions and for the physical therapy visit. If you already have a set of crutches or a walker from home, your caregiver is encouraged to bring them in at this time to have the physical therapist inspect them for safety and to adjust them to fit you properly. Pain management is something that many patients are concerned about, and for good reason. Getting a joint replaced is a big surgery. All of our team members work together to help keep your pain under control. If you are having significant pain when in the recovery area, your nurse will provide pain medication either orally or through your IV, depending on your pain level and if you are awake enough to swallow safely. We also will apply an ice pack and elevate your leg. If you are having your knee replaced, many surgeons recommend purchasing an electric-powered cryocuff or Polar Cube device that can be purchased online or at a medical supply store before your surgery. These can be a bit expensive, around $150 to $200. However, they provide a more convenient and controlled cold pack experience once you're home. Also, when you are home, we recommend that you continue to ice and elevate your extremity and incorporate some non-medical ways to reduce your pain. Never underestimate the power of distraction from a good TV series or your favorite music. Once you are awake and stable, you will be evaluated by physical therapy before you go home. They will check your strength and make sure that you can safely walk with either a walker or crutches. If you have stairs to get into the home, they will review with you how to maneuver up and down with crutches using the correct technique. Also, as previously mentioned, we strongly recommend that you have a secure handrail installed or in place on your stairs at home for safety. How do we know if you're ready to go? You must meet the criteria for discharge. You must be medically stable, have your pain under control, be seen by physical therapy, And if you've had a spinal anesthetic, you must urinate before you leave. Additionally, you must have a ride home in an appropriate vehicle with a caregiver present. We do not allow patients to go home in a taxi or ride share unless accompanied by a friend or family member that can stay with them. If you have a long ride home, bringing some pillows for comfort may be helpful. Again, if you live alone, we strongly recommend that you have someone stay with you for at least the first night for safety. The total length of stay is around 6 hours or so. However, that is just an estimate. Timing of discharge can vary based on your individual recovery, as well as other factors beyond our control. Why go home on the same day? Studies do show that healthy people have better outcomes when discharged on the same day. You get better rest in your own home, can manage your own pain medications, and are less likely to get exposed to bacteria and infections commonly seen in the hospital. We will arrange for physical therapy to come to your home the day or two after your surgery to evaluate you and to set you up with a home exercise program. As with any surgery, there is the possibility to develop complications. However, there are a few things that you can do to help avoid most of them. The first is to follow your discharge instructions carefully. Get up and walk every hour when you are awake, but don't overdo it. Ice and elevate your leg, and drink plenty of fluids. We will discuss complications such as pain, blood clots, infection, and constipation in more detail. Of course, the goal is to prevent them, but even with our best efforts, complications may still occur. Then the goal is to recognize them early, notify your surgeon, and get prompt treatment. Pain and swelling are expected after your surgery, and it usually gets worse before it gets better. So, it is important to stay ahead of your pain by taking your medications as prescribed, icing and elevating, and keeping up with your physical therapy exercises. Icing and elevating is recommended several times per day and after your exercises. Also, if you are feeling well, do not overdo it with your exercises, as this can cause a flare-up that can dramatically increase swelling and pain and can delay your healing. Another potential complication is a blood clot that can occur in your legs or your lungs. You may have heard of the term DVT or PE before. This complication is not very common. However, you should know the symptoms, so if you happen to develop a blood clot, you can get it treated early. You should take measures to help prevent blood clots, such as using the compression devices, the boots or socks, taking aspirin or other prescribed blood thinner, getting up to walk every hour when you are awake, and moving your legs and feet often to promote circulation. If you do develop any signs of a clot in your leg, you should call the doctor right away. This includes leg swelling, warmth, tenderness, and redness. If you happen to develop any symptoms of a clot in your lungs, such as chest pain or shortness of breath, you should call 911. Again, this is not very common, but we do want you to be aware so that you can get treatment right away if it happens. Another potential complication is an infection. We take several measures to help reduce your risk of infection while you are at the surgical center. And once you are at home, you should make sure you follow your discharge instructions very carefully. This includes keeping your bandage clean and dry, unless it is waterproof. You may remove your bandages at the proper time as instructed, but only after washing your hands very well with soap and water. You should also avoid submerging your incision in a pool or bathtub until your surgeon sees you at your postoperative visit. If you do happen to develop any signs of infection, you should call your surgeon right away. This includes a fever, redness, or drainage at the incision site, as well as an increase in your pain level. Finally, constipation is a complication from pain medications that can be prevented. You should be proactive and not wait until you are all backed up. Each day, when taking prescription pain medications, you should also take a stool softener such as a Docustate or Colace or Miralax. You should also drink plenty of fluids and increase the fiber in your diet. If your stool does become too loose, you can always stop the stool softener. If you do develop severe constipation, have not moved your bowels for several days, and have abdominal pain or vomiting after meals, you should contact your doctor to be evaluated. In addition to what was already discussed with regard to potential complications, you should certainly call your surgeon for other things such as if you fall, even if you do not land hard, if you develop excessive bleeding from your surgical site, or have pain that is not controlled by your pain medication. You should call your surgeon with anything that seems concerning to you. Finally, I would like to review a few topics that many people have questions about: traveling, activity, and prophylactic antibiotics. If you do plan on traveling during the next few months, you should discuss your plans with your surgeon to discuss potential measures to reduce your risk for developing blood clots. Many surgeons do discourage unnecessary travel for a few months after your surgery. Also, when traveling, you may set off a metal detector and will need to inform security that you've had a joint replaced. As for returning to sports and activities, we encourage you to get back to the activities that you stopped because of your pain. However, before you engage in any high impact or contact sports, you should discuss this with your surgeon. Lastly, your doctor may want you to take a dose of antibiotics before any invasive procedures, including dental work and cleanings in the future. This will help reduce your risk of developing an infection at your new joint. Your surgeon will be able to provide more information about this. Finally, I would like to thank you for watching. If you do happen to have any further questions or concerns, please call your surgeon's office or the surgical center for more information, and we wish you the best with your recovery.